Good morning and welcome back. It's 8:41. The number of people who smoke in America has fallen to an all-time low. The Centers for Disease Control reports 13.7% of Americans smoke cigarettes. And joining us this morning is Dr. Thomas Klein. He is the medical director of the lung clinic at Good Sam Medical Center. Good morning and thank you for joining us today.
Morning. Thank you for having me.
You know, smoking, and I mean, it's incredible to me that people continue to smoke, but they do. And cigarette smoking is going down, but e-cigarette use is increasing. So some say that's safer. Is that so?
So we don't have enough long-term information to answer that question. There are a lot of people out there suggesting that switching from traditional cigarettes to e-cigarettes may be beneficial for their health. The problem is, though, that a lot of people are going from not smoking at all to picking up e-cigarettes as a starter, and that's really the problem we're seeing with those e-cigarettes.
You know, but I mean, pardon the pun, it blows me away when I see that smoke coming out of, vapors, lungs. I mean, that's amazing.
Right, and there are certainly many chemicals that are in those e-cigarettes that we just don't know the long-term consequences from. As you know, there have been recent deaths linked with e-cigarettes, and so we still need to get more information before being able to determine whether they're a safer alternative to tobacco products.
All right, so a new report says more people are trying to quit. How do you recommend that people try to quit?
So the best way is to talk to your doctor. We have smoking cessation clinics available at Good Samaritan, and talking to your doctor about the best way for you to quit is ideal. There are medications, there's also counseling, and a number of different interventions that can be helpful. But getting in touch with your physician and telling them that you want to quit is the best first step.
All right. The gum and the patch are still some of the norm?
Yes, yeah. Okay. So there's gum, there's patches, there are other medications as well, and in combination with counseling is where we really see a benefit.
All right, so somebody's been smoking, 20, 30 years now. They say, I've got to quit. So they go to some of these smoking cessation classes. They do the patch or whatever. Talk about the health benefits. Once you've been smoking a while and then you quit, what happens?
So even within minutes of quitting smoking, your blood vessels start to repair themselves, bringing more oxygen to your tissues. And then over time, as the days, weeks, months go on, your body does start to repair a lot of the damage to your arteries, to your lungs, to other parts of your body as well. Despite that, there's still an ongoing risk, and so even people who have smoked are at increased risk for cardiovascular, pulmonary, and also cancer-related problems decades after quitting, which is why it's important that they continue to be monitored for those problems.
You're better off never picking up the habit, I mean, obviously. All right, so one of the issues also tends to be that people start smoking at a young age. So what could parents do to try to prevent that?
Well, this is where those e-cigarettes come back into play. A lot of the e-cigarette advertising has been sort of directed and marketed towards children, and so there's a big push to try and get kids to stop picking up those e-cigarettes. As with anything, the most important thing is for parents to be talking to their children about the dangers, making sure that you're aware of what's going on in your kids' lives.
I've had that conversation and continue to do so with my 12-year-old daughter, and hopefully we won't have to go there, so that's good. Thank you for all that information.
My pleasure.
All right, we appreciate you being here. Let's check